So shoulder dislocation happen all the time, by playing sports, or just do simple high five, or sometimes you fall, you're trying to catch yourself. It happen all the time. Over 50 or 60% of the dislocation happen in the shoulder, okay? Shoulder joint is not a stable joint in a sense, but because of that, you can move it to so many directions, okay? So if shoulder dislocation happen, what are you gonna do? If you're playing sports at the high school, you're lucky if you have an athletic trainer, okay? And if you didn't have it, what's gonna happen is you go into the emergency room, okay? And you assume emergency room doctor, they practice reduction technique, they know what to do. Fact is no, okay? They're waiting for you to come and they practice on you, and then you have to pay for it, even though you let them practice. Should be the other way around, don't you think? I'm just saying. All right, so I gotta show you a couple different techniques on shoulder reduction, okay? So this is butt shoulder dislocation later. It's already dislocated anterior, okay? So one technique I teach, there's no name. Well, I kind of named it myself, called a weight shift technique. Use your hip and elbow, squeeze patient's forearm. So your body and patient's arm will be one piece. You wanna shift from here to here. How you gonna do that? Shift your weight sideways, okay? When you get to 90, then you push and you lean back. And if you do that, watch here, clunk. Well, I know after, if you watch this video, people say, well, the reality, it's not that easy. Well, if you can reduce on-site right away, it's easier. I'm gonna say it's easy, but it's easier than you go into the emergency room after 4 or 5 hours, okay? So I'm just saying, okay? And also the tension on this model is adjustable, so you can make it easier, harder, all right? And another technique would be, it's like a Hippocratic technique, but with your hand, okay? Push, and the other hand hold the wrist and push and pull. And then external rotation, like I turn the doorknob. If you do that, go back in, okay? Couple different techniques you can do. You can do a Fires technique on this model. So there's no risk here, okay?
Yeah.
Why you wait? So let's practice. If you have any questions, email to toki@mn-medical.com. I offer workshop, so I will bring finger, elbow, shoulder, and hip model to do the workshop. It lasts about an hour and 15 minutes. So 30, 45 minutes pop-up presentation, 30 minutes hands-on training, and then I'm out. So if you're curious, let me know. If you're thinking about buying it, and so you can practice anytime, sales at techlinetrauma.com. That's my distributor. So thank you.